It was in the midst of deciding whether the company wants to be an FDA-approved product company or LDT,
Yeah.
lab-developed tests.
Yeah.
So we'll talk about LDTs, of course, later on. But a lot of startup companies in the diagnostics, when they offer testing services, ask themselves whether they want to be a testing service company that also develops their own niche technology, or they have already done so and they want to open up a CLIA certified lab as a practice of medicine, so to speak.
Yeah.
Or do they want to obtain FDA approval, and why would they want to do that? Besides the fact that at the time FDA has attempted to regulate LDTs several times. I mean, this is an issue that has been going on for a few decades, and every time, of course, it makes the labs nervous and some IVD companies excited because they always felt that there was not a level playing field, because they had to go through the burden of FDA, and some of these startup companies would come up with a Me Too product and they don't go through it. So we were debating whether we should do this, whether we should do both, and how does that align with our business model? Which business model would be supported with which regulatory pathway, and which would be most attractive to investors, and reimbursement, payer strategy, CMS reimbursement, and private CMS reimbursement and private payers. So it had all these multiple aspects and the credibility and all that stuff when you get an FDA approval. So we talked about all of those things as we were developing our business strategy. So it wasn't like a business strategy was solid in place and then the regulatory had to support that, but it was a regulatory, business, commercial, reimbursement, all intertwined and coming together to create the best scenario